everyone, I'm Dr. Z and welcome to my channel. Today this video is for you if you're planning to get any of the gender-related procedures or if you're actually in a process of getting any type of gender-confirming procedures, but you find out your doctor needs a letter from a therapist. Stay tuned because I'm going to cover everything you need to know about the paperwork you need and pay close attention because there is actually a catch many of you are not aware of that I'm going to reveal in the middle of a video. Also make sure you stay till the end because I have put together a very valuable resource for you that can help you moving forward in figuring out how many letters you will need. So let's begin. For starters, many of you already know that in order to get any kind of gender-related surgeries, you will need either one or two letters from a mental or a medical health professional. To make it easier to follow, I like to break down gender-confirming surgeries into two categories: top and bottom. Okay, in the top category, we have surgical procedures such as facial procedures, for example, facial feminization or facial masculinization, as well as any type of chest surgical procedures such as breast augmentation or mastectomy, which is removal of the breast. In the bottom category, we have any type of surgeries related to genitalia and reproductive organs. For example, vaginoplasty, phalloplasty, metoidioplasty, hysterectomy or orchiectomy, or to put it in more lay terms, penises and vaginas, or removal of ovaries or removal of testes. Now, the reason why I break it down into two categories is because it will determine oftentimes how many letters you will need. Before we get to that, let me introduce you to WPATH guidelines. And you can get a copy of this WPATH guidelines completely for free from their website, and I'm going to put a link below. These guidelines are published by World Professional Association of Transgender Health for providers such as myself in working with gender diverse individuals. Now, keep in mind, these are just guidelines. They're not mandatory, nor are they set in stone, but they're just guidelines for us to follow. But because over the years, they became incredibly highly regarded by providers, they tend to be pretty closely followed by a lot of professionals. Now, in accordance with these guidelines, you will need one letter of referral from a mental health professional for any of the top surgeries. For any of the bottom surgical procedures, you will need two letters from mental health professional. Okay, you following me? So according to WPATH guidelines, you need only one letter for any of the top surgeries and two letters for any of the bottom surgeries. The mental health professional can be anyone with master's degree and up who is competent enough or specializes in working with gender diverse individuals and who can assess and diagnose for gender dysphoria. Now here's the catch. Remember when I told you that there's going to be a catch in the middle of a video? Here's the catch. While WPATH simply states one letter for any of the top surgeries and two letters for any of the bottom surgeries, oftentimes surgeons and insurance companies will create their own additional criteria. Okay? So I know this is incredibly confusing, but they can and they do, especially insurances that will have their own separate categories that will be different from WPATH. So for example, a person may have their first letter ready for top surgery only to find out that their insurance requires two. A very good example of this is Blue Cross Blue Shield. Now, depending on your plan, I have seen myself firsthand that Blue Cross Blue Shield will request two letters for top surgeries such as mastectomy or breast augmentation, when WPATH guidelines clearly states only one letter is needed. Another example is Kaiser. Kaiser is an island in of itself, okay? They won't even accept letters from professionals such as myself, so if anybody evaluates you outside of a Kaiser's, it becomes completely irrelevant and they will disregard it. So if you have a Kaiser plan, you can stop watching this video because everything will be irrelevant for you. Another common example is when you have two letters ready for bottom surgery. So let's say you're ready to get your bottom surgery and you have your two letters and you find out what? That one of them has to be from a clinical psychologist. That's right, not from a master's degree or licensed clinical social worker, but a clinical psychologist. It is incredibly confusing, and I know it makes many of you want to give up, but please don't. As promised, I do have a valuable resource. I have put together a kind of a simple flow chart for you to follow that can help you in figuring out how many letters you will need and from whom. Now it's completely free. There's the link below. You can download it. You feel free to share it with anybody that you feel like can benefit. Also would love to hear your comments, so please comment below. If you find this information helpful, please make sure you subscribe to my channel. Make sure you also like this video and make sure you share my channel with anybody that can benefit from this information. Thank you so much, and I'll see you next Friday.